Hi, I'm Eric. I'm going to be your nurse this evening. I have several medications here that I'm going to go through them one by one with you with. Um, the first one here we have oxycodone acetaminophen, also known as Percocet. It is used for pain relief. You might experience some lightheadedness and drowsiness. Before giving this to the patient, you want to check respiratory rate because it may cause respiratory depression. So this next medication is metoprolol, also known as Lopressor. It is used to decrease your heart rate and your overall heart activity. This can also cause dizziness, it can cause headache and tiredness. So before giving this medication as a nurse, you'd want to check the heart rate, and then to make sure that it is working properly, you'd check it again, probably about 30 minutes afterwards. Same with the oxycodone, you'd want to get a base pain score, and then check the pain score afterwards. Moving on to the next drug, heparin. So this drug is anti-coag, so it's used to reduce the clotting in your blood. So you need to be on the lookout for any bleeding that doesn't normally happen, whether that be in your stool, your nose, any open wounds in your body. It can start bleeding. So if that's the case, you need to notify me or another nurse immediately. The way that we can test this to make sure it's working is by doing a blood test, specifically a APTT test. And then moving on to the next medication is lisinopril, aka Pregabalin. It is used to lower blood pressure. So the adverse effects for this could be cough and dizziness. So you need to notify the nurse if you have either of those two. And what we need to check before giving this is blood pressure. And then we're also going to check again after giving this medication to verify that it is working. Next medication is pantoprazole, Protonox, and it reduces the amount of acid reflux or heartburn. Excuse me. So this can cause abdominal chest pain or diarrhea. The way that we can check that this is working is by asking them if they have any acid reflux after giving it. Of course, you want to get that baseline and see if they're having any acid reflux or heartburn before giving the medication. The last one is the Docusate sodium, what also known as Colace. What this does is it softens the stool, and it helps with regular voiding. You need to ask them before giving the medication when their last bowel movement was. Adverse effects could be excessive voiding, diarrhea, or cramping. And the way to verify that this medication is working is by coming back later and seeing if they had a bowel movement. And you can also ask them about their regular bowel movement patterns. Of course, you want to get that as normal as possible. So before you give any of these medications, which I forgot to state in the beginning, you want to check for allergies to any of these. And you also, if this is a new patient that just came in, you want to check to see what medications they've already taken within the past 24 hours. At least double check with them. I'm sure they've got it during the questioning whenever they came in. I think that's it. And of course, if the patient has any questions, answer them.